Hi, good afternoon. Thank you everyone for coming. I think it's quite good to see such a big crowd on a Saturday afternoon. We're going to just do a very short, brief talk about what gastric cancer or what stomach cancer is, and just to give you a bit more understanding as well as how we treat this condition. All right. Now, this map of the world basically shows that the darker colors are the countries with the greatest incidence of stomach cancer, all right? And you see that Singapore, not the little red dot, but the blue dot is, we're somewhere in the middle. We're not the most prevalent for stomach cancer, but certainly not the least as well. As has been said much earlier, it's number 7th most frequent cause of cancer in Singapore among men, and number 9th among women. And overall, you can see that over the years, the trend for stomach cancer in Singapore is basically coming downwards, which is a good thing. But what's not so good is that despite it being the 7th and 9th most common, it is the number 4th and number 5th killer in terms of cancer. And what this all means basically is that although we are having less stomach cancer in Singapore, it still contributes to a higher risk of cancer death. And the reason for this is that this is a paper, this is a study, research study that was done quite a number of years ago, but it basically shows that in Singapore, a lot of patients present at a much later stage. And when the stage is later, of course, the prognosis is poorer. And if you notice that this is our defense minister when he was still practicing as a surgeon. So looking at the prognosis, basically what it means is that the later stage you find of gastric cancer, the poorer the prognosis, the less percentage survival at 5 years after it's been treated, all right? So the message means that the earlier you diagnose gastric cancer and you treat it, the better the prognosis. And you notice if we do pick up gastric cancer, you're fortunate enough to pick up gastric cancer at a very early stage, you can have almost 80–90% cure or 5 years survival. So just a little bit about what, where the stomach lies in the gastrointestinal tract, all right? This is the mouth. You swallow, the food goes down the esophagus or the food pipe, and it enters into the stomach. So the stomach basically is a bag. It's a bag that allows you to contain food. And that's very important to Singaporeans because we do love our food and we tend to overeat. And this big stomach allows us to put in quite a lot of food before it fills up. Now, the inside of the stomach has a lining, and this lining of cells basically is where the stomach cancer arises from. Now, stomach cancer or gastric cancer presents in the form of symptoms, right? What you feel. When you feel you have some discomfort or some pain in your body, that's what brings you to the doctor, all right? So there are a range of symptoms that occur with patients with stomach cancer. But these symptoms are not specific to stomach cancer. They may suggest to you there's something wrong with you, but none of these symptoms by themselves would tell you that you have stomach cancer, all right? It just gives you a sort of like a warning sign that you should seek medical help. And you notice that some patients have hardly any symptoms. So very early gastric cancer will present with very mild symptoms, what we call dyspepsia. We'll talk a little bit about that later. Or pain in the upper abdomen. The more worrisome things are like vomiting blood or passing black stools. Sometimes persistent vomiting of food. And then as the stomach cancer increases in stage, you find that you may get tired easily, you get breathless when you walk a bit, You lose weight even when you don't intend to. There's no appetite. And when at very late stage, your abdomen, your tummy may become very distended. So what exactly is dyspepsia? It's a medical term, basically, but most patients will say, oh, doc, I feel full, very full, in fact, after eating a meal. Or I can't eat as much as I used to. Just a few spoons and I'm full now. There may be pain in the upper abdomen, or you may have something almost like heartburn after a meal. But definitely dyspepsia is not due to, dyspepsia does not equate to stomach cancer. It could be due to a large range of different conditions. You can have ulcers in the stomach. You can have gastritis, maybe sometimes with an infection. It may be due to reflux into the food pipe. It may be gallbladder pain. It may be due to medication. Sometimes the strong painkillers can give you that. Maybe too much caffeine, very good coffee, foods that are acidic, lime juice, orange juice. Of course, stomach cancer can contribute to giving you dyspepsia. Or it could just be due to what we call functional. That means there's no particular cause that can be diagnosed. It's just the way that your intestinal system doesn't move as well as it should. But there are some alarm symptoms that accompany dyspepsia that may make you think harder as to whether you should seek medical help. If you're more than 55 years old and you have a new onset dyspepsia, never had it before, it suddenly come about. If you have what we call unexplained or unintended weight loss, not because you've been exercising. If you have a family history of stomach cancer, although that's quite rare to have hereditary stomach cancer. If when you eat and you find that the food is stuck in the food pipe, it doesn't go down easily. If you have persistent vomiting, like what we talked about just now, or if you're vomiting blood or passing black stools, if you find that your skin, the whites of your eyes are turning yellow, or you've got anemia that cannot be explained. So if you have all these symptoms and you go to see the doctor, what specialists would usually do is to suggest that you go for an endoscopy. And some of you would have had a chance outside to see the Olympus stall with the endoscope machine. Those of you who haven't, you can go and have a look at it and play around with it later. Basically, it is a flexible tube. It's passed through your mouth, into your food pipe, then into the stomach. And at the end of this tube, there's a camera. And the camera and a light, of course. And we are able to see the inside of your stomach on the screen. All right. Obviously, this is done after giving you some sedation so that you're not wide awake. It makes it more comfortable. All right. And what we want to do is to see if there are any abnormalities in the stomach. And at the same time, we can test for this bacteria called Helicobacter pylori to see if it's present. Right. So this bacteria basically causes damage to the lining of the stomach. The cells of the stomach lining become inflamed, become damaged, sometimes can result in ulcers. And if it's a long-standing infection, there is a small risk of stomach cancer formation. This is just a description of what we just talked about just now. Majority of patients with Helicobacter pylori infection will get a chronic form of gastritis. But frequently, this is asymptomatic. That means you wouldn't even know that you had it. A small 15–20%, this gastritis may end up with a thinning or wearing out of your lining of the lining cells of the stomach, and sometimes cause this condition called intestinal metaplasia. Some of you have had endoscopy before, and the doctor may have said that you have intestinal metaplasia. Basically, it's the changing of the cell type from the stomach kind of cells to cells that come from the small intestine. And when that happens, It is a response of the cells to injury, damage caused by this infection. There's a small chance, given intestinal metaplasia, that this may progress to cancer, but that chance is very small, although that is something that the doctors will look out for. Further down, it may cause ulcers, this bacteria, or may result in stomach cancer. So if we do the endoscopy and we find that you've got a tumor in the stomach, looking like this on the endoscopy picture, then a biopsy is taken, and if that confirms that, biopsy meaning taking a small piece of the tumor cell tissue, sending that for testing to confirm it's stomach cancer. And if that's the case, then the doctor will do further investigations to confirm the stage at which this stomach cancer is. And this is a CT scan frequently done nowadays as a part of the workup for stomach cancer. And what the CT scan gives us is an image, X-ray image, that shows us where the tumor is. This is the stomach, and the white colored stuff is a white contrast liquid that's given to show us the inside of the stomach, and you can see that there's a tumor here. And sometimes it can tell us whether the tumor has spread anywhere else. This is the liver, this is the stomach, and if the tumor has spread outside into the liver, we can also see that on the CT scan. If you're fortunate enough to have a stomach cancer that's diagnosed very early, looking at this endoscopy picture, you can hardly tell that it's there, but a trained endoscopist would be able to pick it up. And if it's very early, that means it's confined only to the lining of the stomach. It's not gone into the muscle wall or beyond. Then it may be possible to remove this tumor using the same kind of endoscope that you see outside, but a slightly bigger one that allows us to use special instruments to remove it. We can inject some salt water or saline, raise the tumor up, and then cut around it, and the whole thing is taken out when it's a very early stage, taken out just by the endoscope itself. You do not need to remove the stomach for this procedure, but that only works if it's detected very early on. If the tumor has already caused an ulcer, then that's not possible anymore. This is a little bit more advanced, but still able to, still amenable for us to treat. And in this kind of case, you need a removal of the stomach, what we call a gastrectomy, and in order to give you cure. All right, and gastrectomy can be done with an open cut in the traditional method on your abdomen, or with small little holes nowadays, what we call keyhole surgery. The good thing about keyhole surgery is that the wounds are smaller, and of course the pain is less, you get faster recovery, and it allows us to take out this tumor much more easily. And it is done through, again, another scope that's put into the abdomen through one of the keyholes, special instruments that are used, something like that, and then you can see the inside of the abdomen, and you can cut and remove. And the doctors operate on screens like this in a dark room, much like a cinema, and you can see them trying to do that. But if the tumor is more advanced, it's more difficult to do, it may not be done that way, and we fall back to the traditional method of a big cut. It allows us mainly to remove the tumor, make sure you get all of it out, you don't leave any tumor behind. Remove the lymph nodes around the stomach as well, because that's where the tumor cells tend to go to. And the aim is to give a curative operation to take all the cancer cells out. Depending on where this stomach cancer is, if the stomach cancer is at the lower part of the stomach, this is the stomach. If it's at the lower part of the stomach, then there may be an option to just remove part of the stomach. Usually we'll say that's about 3/4, 80% of the stomach. And we leave a little bit of stomach left on the top. And then we use the intestine and bring it up and do a joint back so that when you eat, the food will still pass through the remaining stomach. into the intestine. All right. If the tumor is found on the upper part of the stomach, then it's not possible to do that. The whole stomach has to come out. All right. So we take out the whole stomach, and a frequent question would be, Doc, how am I going to eat? Of course, Singaporeans very pragmatic. All right. How are you going to eat? So we take the small intestine and we bring it up and join it to the food pipe, which is up here. And then that still allows you to eat. All right. After the tumor has been removed by surgery, together with the lymph nodes, we know exactly what stage the stomach cancer is. Then, in cases where it's a more advanced stage, then there may be a need to offer you chemotherapy. All right, we know that that helps because stomach cancer at a more advanced stage, there's a likelihood that some cancer cells may have already escaped into the bloodstream, and the chemotherapy would help to target these cancer cells in the bloodstream. It can be in the form of what we call intravenous or through the blood chemotherapy, in addition to tablets as well. And your surgeon would refer you to a chemotherapy doctor or an oncologist to do that. On occasion, if we diagnose stomach cancer when it's already very late, all right, the tumor is spread. For example, you saw the CT scan picture just now, it's gone into the liver. It's no longer possible to remove it for the purpose of curing you. Then we may not remove the tumor, but certainly other things can be done. If the advanced tumor ends up being causing problems, causing blockage, causing bleeding, then we may have to treat those complications, those problems as and when they occur. And in this case, you can see if the tumor causes a blockage, you can put a stent. You can put in a stent, which is a wire tube, a tube that's made of a wire mesh. And this is done with endoscopy together with some x-rays, and we can put a mesh, this wire mesh in order to open up the blockage caused by the tumor. And that would still allow you to eat. All right, we're almost done. All right, what happens after you remove a stomach after an operation? All right, obviously without the main bulk of the stomach, with a little bit of stomach, or with no stomach and just joining the small intestine to the food pipe, then you can't eat much, right? So basically very small but frequent meals. There would be some weight loss initially. Appetite will also go down, but generally speaking, most patients will recover most of their appetite by 6 to 9 months. They can eat better, larger meals. Maybe not back to normal kind of size before surgery, but most patients will be quite happy by 6 to 9 months. So, in conclusion, there are various treatments that are available depending on what stage your stomach cancer is at when it is diagnosed. The main message is seek medical treatment early, especially if you have dyspepsia that doesn't go away, or you have any of those alarm symptoms we talked about. An endoscopy may be necessary to make a diagnosis, but bear in mind, early detection allows for less aggressive treatment and better survival outcome. All right, thank you.